2% of the total costs without parity, then they can apply to the secretary for an exemption. But they have to be and then they would be allowed to offer their health benefits without the parity rules. Does that help? Oh, I'm sorry.
With regard to, I'm thinking about autism, and you mentioned something about autism earlier. Do you know if how the treatment for autism that fits into?
We don't have any. We don't have regulations around what's going to be considered mental health and substance abuse disorders. So I can't answer your question on that because we just don't know. Senator,
could I make a couple observations? One is I liked your slides of Dorothea Dix, and there is some suggestion in at least one of her biographies that she visited every state east of the Mississippi, and that would put her in Michigan, though I haven't been able to find any direct evidence, but in another biography of Michigan's governor of the day, Epaphroditus Ransom, in the 1840s, it's claimed that he heard her speak, and that is when he became a proponent of establishing a Michigan state asylum system. He then left the governorship and became the state representative, the only governor to serve in the legislature after he was done being governor, for Kalamazoo. And that's why Kalamazoo is the site of the first state psychiatric facility, which is still in existence. That was one observation. The other one is there have been changes in commitment laws, over time, and also the new pleading, guilty but mentally ill, I think was put in place in the 80s, and these things have had an effect on our prison population and our ability to compel patients to receive treatment. Commitment standards have changed. Now it's much tougher to compel someone to have treatment. So compliance, obviously, is a public policy question. How far can we go to compel someone? Do they need to be dangerous? What is that? How dangerous do they need to be before we could compel them to have treatment? And then guilty but mentally ill has given juries the option of incarcerating people. Before it was, guilty, not guilty by reason of insanity. And this plea has, I think, been one of the features that has increased the prison population. The other observation, the final one, is that the legislature has at least 5 mandate bills in front of it, and they're recurring. They were here last session. They're for medical food. For certain conditions where special medical food is prescribed. They're not prescription medications. The second is for contraceptive coverage. Another is for pain management. We see that from time to time. I'm an anesthesiologist, by the way. Let's see. Another is for autism. And you've seen a demonstration, on the Capitol today related to that. And then another is for immunizations, which the autism advocates, some might have an objection to. And I mention this because, mental health parity is in this context or this environment with these other things. And it's difficult for the legislature to pick and choose. And all the arguments are the same. If you cover us, well, we'll save you money down the road. And we hear that all the time as legislators, but it's not always true. I mean, everybody says that, and there's no peer review. There's no requirement, that their arguments are backed up. So I tell you this so you know this is the context that you're in. And finally, the movement at state levels to cover the uninsured often involves creating a skinny down policy that's free of mandates or requirements. And I would allude to Access Tennessee, which has replaced Cover 10 in part. It's a skinny down policy. You get 5 or 6 physician visits per year, not 10. You get 1 outpatient procedure per year, not a series of ECTs. But yet it's more affordable, so you can cover more people. So again, I tell you this because this is the environment that you're in if you're asking for coverage for more services.
Thank you. Any other questions? No?
Well, on behalf of Craig Ruff, who you met earlier, and the Wolverine Caucus, we want to thank you, Dr. Grazier, for this
Thank you.
excellent presentation today, and present you our vintage Wolverine Caucus pen.
Oh, good.
Thank you again.
Thank you very much. And thank you all for allowing me.
Wanted to thank Dr. and Senator Tom George for your commentary today and your introducing our speaker, and also to acknowledge that Representative Kevin Green joined us today, and Sia Segerlin from Representative Pam Burns' office was here, Jack Cardinal from Senator Jacobs' office, and Tim Mitchling from Rep. Geis's office, Kelly Cairns from Rep. Robert Jones's office, Jennifer Walker from Representative Slezak's office, and Sherry Sophia from Senator Tom George's office. And I want to thank all of you for coming and joining with us on this very substantive topic. And we hope you'll come again in June, when we have, on June 11th, the next forum. So you'll be getting information about that, and I wish you all a very pleasant afternoon. Thank you.
I know all about you. So you're going to go make it.